Okay, what I'd like to do is to make some general remarks and then invite the panelists up to the podium. This will give you a little time to kind of sit down and
all four of you.
so I think that for those who attended all today, I would say it's just a phenomenal day. You know, the keynote by Laura Kunston, followed by 3 sessions on biology of aging, aging, cognition and frailty, and aging society. I think to me it's very, very clear. This is an important area. As someone said, we have an epidemic of this problem. It has health, has social, economic, and certainly societal impact. And I want to thank all the panels and speakers for really making a phenomenal day. So my question is, what's next? So we heard a lot of really good discussions. And of course, like many of you, we like to say, are there directions we need to take? In fact, what's next? What's not working? What's working? How do we fix it? And what are the innovations, disruptive innovations, that not just change the scientific and social understanding of aging, but also significantly improve the health and well-being of the elderly and transform the way the elderly live and function independently? You kind of heard a little bit about that. And then are there ways to intervene with the natural biology of aging, the pathophysiological processes, slow infirmities, and maybe extend longevity? I recognize immediately when I say all this, we heard a lot about socioeconomic health disparities. We recognize that. And of course, by talking about innovation and technology does not preclude the need to address this. But assuming that technology innovation provides a tremendous breakthrough and that's available to everyone simply because it gets down to the level of implementation, I think this is going to be very exciting. And that's what I want this concluding panel to talk about. Now, this President's Forum is something that we wanted to do just to bring together the innovators who are at the forefront of their fields to identify a path towards a healthier future. So I feel, as we're thinking about big issues, this is a big issue. I'm looking at Bob Horwitz. Is this a grand challenge? But it requires for us to take bold steps to say, how can we extend health span and lifespan? And so with all that, I'd just like to introduce the panel, 4 distinguished speakers. Each one represent an innovation. And that, if successful, can have tremendous, enormous gains. Each one invested in their own time and energy and scientifically into this innovative idea, personally and professionally. I think you can say they made a bet. You know, while we heard all the possibilities and all the problems, these individuals have moved forward to say, I'm going to make a bet to make these things happen. And that's what we need. And they also represent academia, industry, private philanthropy. So I think this is really going to be a very exciting conversation. So I'd like to introduce our speakers. First with Hal Barron. Hal is the President of Research and Development at Calico. How many people have heard of Calico? Show of hands? Okay, well, if you haven't heard about it, he's going to tell you about this. But as you know, Calico is an independent research and development biotech company established in 2013 by no other than Google. Google's investing in longevity and aging research. Do they know something we don't know? Right? Google's going to give you driverless cars and all those innovations. So I think it's so exciting to get Hal to tell us about, their thoughts and what's in the future. Innovation. Well, he's one of the most respected clinician scientists and successful drug developers in biotechnology. Prior to Calico, he was Executive Vice President and Global Product Development and Chief Medical Officer at Hoffman LaRoche Genentech, where he was responsible for all the products in the combined portfolio of Roche and Genentech. So Hal, why don't you come up and join us? First, take your seat. Next person I'd like to introduce is Joe Coughlin, Director of the Age Lab at MIT. Joe is the founder and director of MIT Technology Age Lab, the first multidisciplinary research program created to understand the behavior of the 45-plus population. Joe, let the bar go higher. The role of technology and opportunity for innovations to improve the quality of life and older adults and family. I think that's an area we didn't talk enough about. I think Patricia just began to talk about healthcare. Well, I can imagine what is the design home of the future for the elderly, right? That's going to be phenomenally important, in my opinion. So he's done lots of good stuff, looking at convergence of baby boomer expectation technology, how that will shape the future of public policy and drive innovation across global industries, financial services, transportation, food, insurance, health, IT, telecom, and retail sectors. And previously he served as the chair of the OECD Task Force on Technology and Transportation for Elder Persons. Come on up, Joe. The next person I'd like to introduce is Dr. Jun Yoon. He's a managing partner and president of Palo Alto Investors and a benefactor of the Palo Alto Longevity Prize. Jun is a physician, but now he's a managing partner and president of the Palo Alto Investors, which has a great investment, about $2 billion in assets invested in healthcare. He brings clinical expertise, his own passion and industry experience, and the knowledge of physician. And he actually put his own money, as a number of philanthropists have done. There's Larry Ellison, Peter Thiel, to create prizes to stimulate research in this area. So I'm going to ask him, what's wrong with NIH? And so, come on up, June. And finally, Craig Venter, co-founder, executive chairman, and CEO of Human Longevity, Inc. So we all know Craig. And when I said, Craig, you're into human longevity? I'm going to bet on him. Chairman and CEO of the Craig Venter Institute. Well, we know that he's been a leader in the field of genomics and pioneered in 1984 random high-throughput cDNA sequencing, a revolutionary tool for rapid gene discovery, so-called EST libraries. In 1994, he founded the Institute for Genomic Research, or TIGER, part of JCVI now, a not-for-profit research institute. In 1995, he and his first team decoded the genome of the first living organism, the bacterial Haemophilus influenza. But we all know him when you see his image with Clinton, Tony Blair, and Francis Collins on the decoding of his human genome sequencing 20 years ago. So come on up, Craig. Now, Craig is going to kick off with his remarks. He has 15 minutes, and then what we're going to do is ask each of the panelists to give 5-10 minutes or 5-6 minutes of their perspective. Then we're going to have a great conversation. Craig, welcome.
Thank you.